I want to do this story. You know, you've been on the morning show before. We did a lot of COVID stories over there. We always like to talk about COVID.
Just let bygones be bygones, man.
Yeah, the Atlantic article, right? Just let it go.
Good people can disagree.
Well, the argument is out there is that COVID is over. Everybody's saying it's over. It's done.
No,
it's gone.
isn't.
What do you mean no, it isn't?
It's nowhere near over. In fact, I was wondering why you're not masked up right now.
Isn't
it
it
boosted? You're supposed to still be getting boosted. I hope everyone knows that.
You know, first of all, vaccine, safe and effective. Just want to say that.
Well, now that the triple-demic's coming up.
Well,
get all three at once, too, I would say. Don't even worry about that.
Well, also, too, there's another treatment out there, too, as well. I don't know if you heard about it. It didn't do so well.
Remdesivir?
Yes.
I saw it on the screen.
Otherwise known as Run, Death is Near. I'll play a little video, but the title of this section is called Meet the New Bosses. Guess what? Same as the old bosses. And this is why I say COVID is not over, because there's a lot of stuff still going on.
Is that the successor of Fauci?
This is the successor.
They didn't pick Peter Hotez?
No, they did not.
Oh.
Fauci. But Peter Hotez is doing his thing. He was just in Brazil talking about, you know, the global pandemic and what we can do. And
tropical disease or undertreated tropical diseases.
Something like that.
Yeah. That's why I first heard of him. And I remember like, what, tropical diseases? I didn't know that you could just get tropical disease everywhere. And then because he works on, that was his thing that he was selling was
Isn't he a healthy looking guy? He's a guy you want to really take advice from.
This guy's only 36. You believe that?
No way.
He looks great.
So this is Fauci's successor. And this is why I say COVID's not over, because the same psychos that were in office before, they're replacing them with new psychos. Same thing. Fauci's successor at the NIAID pledged dangerous remdesivir drug as the silver bullet against COVID-19. So no matter how many times we've heard remdesivir, and I don't know if you know about remdesivir, failed the Ebola trials. They couldn't use it. It failed the AIDS trials, so they couldn't use it. But, you know, if you're a friend of Dr. Fauci and he's a friend of the drug companies, they'll bring it back for you.
It's a AIDS drug?
It failed.
Oh,
it wasn't.
So that's misinformation.
It wasn't.
Don't take it for HIV.
It wasn't approved. It wasn't approved for AIDS. It wasn't approved for Ebola. So they approved it for COVID-19.
Okay.
Dr. Jeanne Marrazzo. I'm glad they used an Italian to replace another Italian.
Sounds
the newly
like the
minted
angel that brought the tablets of Mormon to Joseph Smith, the angel Marrazzo.
Marrazzo. I don't even know who that is. The newly minted successor to Dr. Anthony Fauci at the NIAID was recently one of America's chief hype women for an antiviral drug that is now unanimously considered an unsafe and catastrophically failed treatment of COVID-19. Prior to her moving to her government health post, Marrazzo was a longtime director of the Division of the Infectious Diseases at the University of Alabama at Birmingham, UAB. In partnership with Big Pharma drug maker Gilead, UAB played a major role in the research and the development of remdesivir. The drug was developed over a decade ago with the hopes that it treats hepatitis C and the respiratory syncytial virus RSV, but was suddenly repurposed to treat COVID-19 when the coronavirus hysteria reached the United States. Given the UAB-Gilead partnership, one would think that Dr. Marrazzo would refrain from commenting on issues through which she maintained a clear conflict of interest. And this reminds me of, what's his name? The guy who is now Lloyd Austin Taylor, or Lloyd Austin, the dude who worked for Raytheon, was on the board.
Yeah, Lloyd Austin.
And then he had to get a flight. Same thing right over here with this person. And she's out there right away just bragging about it. You can see it says,
yeah, I don't understand. Why did they say one would think she would refrain from that?
Yeah. Conflict of interest.
That doesn't exist at the upper levels of everything. Like, it's not even a big deal. I mean, like, that's how everything works.
Nowadays, everything. I don't think this would work 20 years ago, 30 years ago. It was, you know, there would be a conflict of interest thing.
Really? 30 years ago? You don't think it would be the same issues?
I don't.
Probably worse now. Yeah, you're right.
I think it's just more in your face. They're just more easy to do it. The public is definitely buying it a lot easier. They're not, you know.
Well, 91 was when they started advertising prescription drugs on TV, I think. Yes. Or 93? 91
I think it was 91 because it was the year I graduated high school. So.
And I remember it seemed really strange. And it was like kind of, hey, that's weird. They do that. And then I just forgot about it. And then,
well, it's
and it's the craziest thing in the world.
Yeah. It's weird because they stopped doing cigarette advertising. Remember, you couldn't do that back in the days. They would have commercials where a surgeon would come out, take off his
Cigarettes are
stuff.
out. Yeah.
Now they don't do it. Even worse, Marrazzo bashed harmless and low-cost alternatives like hydroxychloroquine while hyping the super expensive Gilead UAB competitor drug. The hope was maybe if you treat early diseases, you don't need a silver bullet such as remdesivir, she told the Washington Post in a July 2020 piece. Hospitals are on the razor's edge, she added, contributing to the fear and paranoia that was enveloping the nation at the time. In an interview, Dr. Marrazzo had nothing but good things to say about remdesivir despite the lack of data available to support her outlandish claims.
Hospitals are on the razor's edge of what?
I don't know.
Being overcrowded or something?
Maybe a razor's edge of what to do, I guess, of how to treat. I mean, they have NIH, protocols, but their protocols. People are going on ventilators. They're taking remdesivir, and they're not doing too well. And there she bragged about the remdesivir online as well. So she comes in. She's going to replace Fauci. New boss, same as the old boss. I was in Defeat the Mandates in D.C. a couple years ago. This is over a year and change ago, about almost 18 months ago. And I spoke to one of my favorite doctors over here. This is Dr. Ryan Cole. So many people back in the days, they put this stuff out there. Yeah, the marketing out front says the vaccine's safe and effective. You should use remdesivir. Horse paste doesn't work to fix things. But behind the scenes, it's all in black and white. And a lot of people were talking about this stuff way before now, before Tucker started talking about it, whatnot. This is Dr. Ryan Cole almost 18 months ago. Take a listen to what he has to say about remdesivir to the T.
The drugs you mentioned, remdesivir.
Is there volume?
You didn't mention it, but you did mention molnupiravir, remdesivir. What are the issues with these drugs right now? Because I'm hearing that remdesivir is just awful.
I call it run death is near.
Run. Are you a comedian telling me run death is near?
Run death is near. That's what I call it. And it's the same reason, though. Because if you don't get it on board in the first couple days, it's pointless. The majority of the patients with the earlier variants that went to the hospital were showing up once the clotting phase hit, about day 7-ish on average. Some went earlier, depending on how fragile they were. But if you don't get it on board to inhibit viral replication those first couple days, then it's like peeing on a forest fire, because it's going to do nothing other than harm. And when we look at the history of remdesivir, it was kicked out of Africa and the Ebola trials because of the toxicity and death that it caused. In animal trials, remdesivir put 25 to 33% of animals into kidney failure. So when you hear these stories coming out of the hospitals, gosh, we've got this respiratory virus causing all this kidney damage, I'm like, it's not necessarily the respiratory virus. And then when you look at the data of where it was used and the actual death rates going up in those hospitals wherever remdesivir was used. And again, you have to understand the virus. It has a replication phase, and then you have a clotting inflammatory phase of the disease. Well, when in the history of medicine in the last 50 years have we not known how to treat clotting and inflammation? And we have hospitalists unwilling to give proper steroids, proper dosages of anticoagulation, anti-clotting, and then they're saying, patient comes to the hospital day 10 and they say remdesivir, and they get reimbursed by the government more money for putting that needle in your arm.
Gotcha.
So they get more, and if they follow the NIH protocols, they get a happy pat on the back bonus from the federal government. And we followed the Fauci protocols and we got big money. Instead of saying, we're in it to do the logical right thing, no matter what the drug is, we're going to do the right thing by the patient to end the pandemic. Instead, there's these financial interests with drugs that are dangerous, used the wrong way at the wrong time. That drug should go in the dumpster of history. That drug should never be used again.
Kurt? I don't know. It killed some animals here and there.
Have we thought about treating it with Vioxx? Dust off Vioxx.
Vioxx, bring it back.
A little bit of kidney failure.
Sudafed or some shit. Listen. You know the fact that it killed animals left and right. It failed the AIDS trials, failed the Ebola trials, but it was all about the money. All the money incentives were there to use it.
How bad does a drug have to be for it to be kicked out of Africa, where they can't even inflict it onto Africans? They have to, all right, we'll take it out.
They can't even inflict it on African animals. It killed animals.
Jesus
literally.
Christ.
And they brought it back and they gave it to everybody who had COVID-19. And this is what we were seeing. People were dying from kidney problems not from respiratory problems. So we knew it wasn't COVID-19.
Well, I didn't.
Yeah.
I
Well,
didn't know anything.
the vaccine is safe and effective.
I don't do research.
You know what I'm saying? Just want to make sure. And they also stopped to do this to make sure that they had this remdesivir. They shut out hydroxychloroquine. They shut out ivermectin.
Yeah,
I don't know if I have to say
the way
anything,
they
or-
talked about it, they described it as if it were remdesivir.
Yeah.
Like, they attributed a lot of the things of remdesivir to it.
Yeah. And he also talked about the money incentives. I think is really important to put it out there because HHS, Health and Human Services, they dictate where the money went, right? The CARES Act said we're going to kick all this money to HHS. HHS is going to make a decision on how you get money. There were bonuses if you have a positive COVID test in the hospital. There were bonuses if they put you on remdesivir. There were bonuses if they put you on a ventilator. So the incentive for the hospitals were to put you on these protocols. And on the NIH protocols, if you look down on like number 19, little small print over there, ivermectin and hydroxychloroquine was there. So they put it out in front of you. They gave you the information. This is something I want to ask you, Kurt, because there's a lot of information. They always put the information out there that the real deal, what's happening with the real deal. Another, the marketing out front, when you have the newspapers, when you have mainstream media, they'll give you the marketing. But they tell you the truth. The truth is there.
No,
right?
yeah, it's your obligation to not read it as a good citizen.
So why?
You're supposed to not look at it.
Okay, so why do they tell you the truth, though? Why do you think?
Why do they?
Yeah.
Off the top of my head, it's probably a trap. I have no idea.
Well, I mean, if you talk to some of our friends,
It's probably where they go if you want to sue, and you're like, "Well, we said."
Well, we have it there. That's something that so the disclaimer. So they said you can't sue them.
The iTunes agreement or whatever you did there, where you signed your soul to a tech company to play brick breaker or whatever.
Yeah.
For Candy Crush, I sold my entire identity one time.
For Candy Crush.
Yeah, for an extra jawbreaker. So I imagine it's that kind of a scam.
Well, there is some talk that a lot of the reasons why they tell you this stuff is because it's karma. So if they told you, it relieves, it frees them from any type of karma coming back on them.
Wait,
like that.
Hold on. What? You think they're thinking in those terms?
Well, if you talk about like the elites, the effective altruism people, the people who are running this planet over here, that if they tell us in some way, form, or another, even if it's in the background, then karma-wise, it can't come back on them.
Well, there's a lie. Look, to make it work, there's a lie for every level of the operation to help that you can lie to yourself and be like, this is okay. You got to figure the consulting firms that they go to maximize the profit, like how they did with OxyContin. Yeah. McKinsey, they helped them sell while it's being spread around that it's worse than heroin. They're like, they had the biggest OxyContin numbers thanks to McKinsey. And people talk about like McKinsey like they're bad, but that's what all consulting companies do. Yeah. And I can't remember, I've been watching these people that if you want to get into consulting, it's very boring. They all talk in that corporate dickhead talk. But you watch how they talk about stuff and it's like, oh, wow, this is how everything works. Because they call it the top down. It's a pyramid principle. They're like, because you're telling these guys how to make more money off their, so don't get bogged down in the little details. Yeah. They just want to know, why do I care about this? He actually gave a medical example where I'm like, wow, there wasn't even one thought to any of the patients whatsoever. It's like, how can we max everything's set up that way? And it's like a pyramid. They call it that. Yeah. Yeah. I think also too, a lot of times they tell us this stuff too as well, because it's just part of the programming, desensitizing us to stuff. 100%.
They just desensitize. I mean, because so many
How
stuff
many
is in
movies
there.
did you watch where a secret agent has to torture and do whatever to save the goddamn world?
Absolutely.
And I mean, like all of them, everybody assumes that every single thing that you get pumped into, like, oh yeah, but they probably have a secret computer that has all the stuff, or a spaceship, or like you just have a program too where you're like, well, I hope they have, but then in real life, you're like, yeah, they probably don't. Yeah. The way they you'd have no problem with it if they did.
No. And the way they label everybody just a bad guy, like he's not a person anymore. He's just a bad guy. He's expendable. He can be killed. That's it.
Yeah, so Star Wars.
You know what I'm saying?
And I agree with it.
So now we have the new NIH person pushing remdesivir, the CDC. You remember what was the name? Rochelle Walensky?
Yeah.
She's being replaced now too as well.
Oh.
Check out this person. I have a little video from a local news channel about the person who is now replacing Rochelle Walensky. And, I wish I had a bell to go off for every single time they say something stupid or just amazing. Take a look at this one. This is Rochelle Walensky's replacement, Mrs. Cohen, Dr. Cohen.
As
one.
Dr. Mandy Cohen walks into a room of CDC staffers, it has the feel of a first day of school.
Hi.
Employees assessing the new boss, the boss hoping to get to know her team, an agency that consists of 20,000 staffers around the world. This is the first gathering of what Cohen's calling Meetups with Mandy, a laid-back gathering she hopes to replicate. The internal medicine physician, mother of two, who regularly wears a Hebrew high necklace, meaning life, had early inspiration to get into the medical field. Her mom was a nurse practitioner.
I saw how her work really impacted not just the person she was serving, but their families and then communities.
We joined Cohen in Atlanta at the CDC's headquarters shortly.
She's not diverse. She's not diverse enough. That's why they're highlighting her Hebrew necklace. Like, oh, they gave it to a white woman. Like, don't worry, she's diverse, right? That's the most diverse she's got. All right. In the medical field. I like they're all already, it's like their children.
Meetups with Mandy, a laid-back gathering she hopes to replicate. The internal medicine physician, mother of two, who regularly wears a Hebrew high necklace, meaning life, had early inspiration to get into the medical field. Her mom was a nurse practitioner.
I saw how her work really impacted not just the person she was serving, but their families and then communities.
We joined Cohen in Atlanta at the CDC's headquarters shortly after President Joe Biden chose her as director, replacing Dr. Rochelle Walensky, who recently stepped down.
What was it about the CDC that made you say, I want to get back into the public sector?
So when an opportunity to lead an agency whose mission is to protect the health of this nation and frankly the world, it was easy to get to yes. Good afternoon. I'm Dr. Mandy Cohen.
Cohen became a household name in North Carolina, leading the state's Department of Health and Human Services during the height of the COVID pandemic. At every turn, Cohen, armed with her graphs and preaching what were known as the 3 Ws, spoke to North Carolinians
Women,
through
racism, and
constant press
Russia?
conferences. She gained respect from both sides of the aisle in this politically purple state.
While we saw trust go down in lots of institutions, we actually saw trust increase in North Carolina. So we measured trust in the Department of Health and Human Services, and we saw that increase.
But being trustful is not something the agency she now heads has recently become known for. A study published in March by Health Affairs found 26% of Americans in a survey last year did not have a lot of trust in the CDC.
Do you think, though, there were things that could have been done differently at the CDC?
Folks have been very clear that the CDC did lose trust. There were some early places where the CDC did not perform and execute in the way that they needed to.
The agency was criticized during the Trump administration for becoming political and moving too slow on COVID, while under the Biden administration, it was condemned for not communicating clear guidance on COVID.
That's BS. That's not why they got criticized.
Lock us down faster, Trump.
I know, right? It's like, that's the BS. And what'd you say the 3 Ws were?
Women, racism, and Russia.
There you go. She had her own 3 Ws.
They made up a new 3 Ws.
It's comical, these people
It's
they
like
hire.
watching Nurse Ratchet. That's Nurse Ratchet.
We got more.
Cohen says she plans to focus on transparency, execution, and building relationships with the public, health leaders, and politicians, Democrat and Republican. In Congress, House Republicans are looking to make significant cuts to the CDC in the budget.
Just like we have a military to protect us here and around the world, we need a CDC that can protect us. We cannot see those cuts and have the national security asset we need here at the CDC.
A threat to national safety could play out this winter. Cohen says she's closely watching the risk of a triple-demic, a mix of the flu, RSV, which the CDC recently approved a vaccine to be administered to people of some ages,
There it
and
is.
COVID, which Cohen tells us the CDC will likely issue guidance on in September for how often to get vaccinated.
Here it is.
We anticipate that what COVID will become is similar to what we're seeing with flu shots, where it's going to be you get your annual flu shot and you get your annual COVID shot.
Convincing all Americans to...
I gotta stop. Did we not tell you so? Did we not say for so long they're gonna make it a yearly shot? Especially when it's a coronavirus, because it's gonna always morph and move and be something else. Dr. Cole, who I played earlier, he once told me, Kurt, he says you cannot make a vaccine for a coronavirus, even though our vaccine is safe and effective, says the CDC, because it's like playing whack-a-mole. As soon as you get a vaccine for it, it's going to change. It's going to morph. And then you're going to need something different.
Well, and this was like a well-known thing. The flu also. I never got flu shots because
you racist.
Way back when. Okay? And especially I work on shows and they'd be like, hey, we're going to get flu shots. There wasn't any kind of mandatory thing. I was like, what? Why? No. I'm 80. Because that was, and it only would treat one kind of flu. They told you that.
Yes.
So I'm like, well, how do you know you're getting, like, what's the point of that? I wasn't like, it's going to hurt me. I was just like, why would I even bother with that?
Yes.
I get the flu, like, I don't know, I guess like once every 10 years, like.
Yes.
And I lived. Yeah. So anyway,
this is like
a real great.
Look,
that's a great scam, man.
I was good at history, PE, and lunch in school. I sucked at like health and science and whatnot. But these are basic things I know.
Were you graded on lunch?
Yes. I was valedictorian.
My goodness. You were valedictorian.
I made the best salads at the salad bar. Forget about it.
I went to public school. We didn't have funding for take lunching.
I got an A in lunch. We still have a little bit more because there's some good stuff over here. So now they're telling you, ladies and gentlemen, and this is why COVID's not over. We showed you who's replacing Fauci over there, Dr. Fauci. Now we're showing you who's replacing Walensky. Okay? It's not over. It's more than just with the actual pandemic. It's what comes of it, right? The QR codes, the CBDCs, which are right on down the road, central bank digital currencies. And guess what? Your yearly flu shot.
Oh,
that's combined with your COVID shot.
You been to the LAX and flown out in the new store where you just go in, it's got like a gate and you just scan your iPhone.
I see them. I saw them.
You just grab the stuff. It's really handy.
Yeah. You guys played on the last show, the girl going, oh my God, this is so cool.
Yeah.
And you guys did a whole spiel on it. That's what it was about. It was about moving you into QR codes. It was about replacing all of society with track and trace programs out there so they know where you're at, what you're doing, and when you're doing it.
Well, I got even better news for you, Positive, because pretty soon you'll be able to order pizza with your mind.
No.
You saw that. On 60 Minutes.
Get a shot is the challenge.
I'm very worried about folks not vaccinating their kids. There's plenty of other things that are hard as parents that we can't do. This is one that we can.
Why?
What do you mean, like feed them and get them other medical care?
Yeah. What? Yeah. Make sure they're getting enough exercise and eating right and stuff. Yeah. Well, why? What is the percentages of kids dying from COVID? Like 0.0001
we don't know those numbers. And even if we did, we wouldn't.
There are some people out there I know because they had children around COVID time. That's why they kind of strayed away from going with the whole protocols, because they start running in a room with all these needles when your kid's born and they want to just shoot them up. It wasn't like that back in the days when, when we, I don't want to, how old are we?
I'm 46. So
all right. So I'm a little bit older than you.
How many, I don't remember how many shots I got.
I think I got 3 when I was born in like 91. I think there was 3, like measles, polio, mumps, or I don't know what they were, right?
I got all those on those.
Those, what I'm saying.
Somebody told me there's like 72 now? That can't be right.
I don't think it's 72. I think it's something like
genders?
17 or...
There's 17 and 72 genders. My bad.
But here she is. You racist. Here she is. Wait, misogynist for that one is. I'm losing. What did they call?
It's all the same.
It's all the same misinformation.
All right.
What you're saying.
Can I say Nazi?
Yep. No.
No. Sorry.
My God.
Sorry, my bad.
Say the celebrated Azov battalion.
Come on, Zelensky's Jewish. Stop.
How could he be president if he's Jewish?
Jewish. Shooting up your kids. So tell me COVID's over. They want you to get a yearly shot. They want them to jab up your kids. If you get sick, they want you to take remdesivir. These are the new people. Same as the old people. So here we go.
In many ways, the job of a government agency head is part policy and part communicator. Cohen is doubling down on the latter, trying to create a camaraderie within a worldwide agency, while aiming to restore trust in medicine and in a place where the goal is about saving lives. In Washington, Reuben Jones, Spectrum News.
I don't know about you, Kurt, but I feel now a lot happier and safe and confident now that she's taking over the CDC.
This is like year 5. Like all the news, it comes off like an infomercial now. But infomercials were more like intellectual, like they kind of respected your intelligence more with the fake talk show infomercial than this. Yeah. This is like a kid show.
Yeah.
Like your first day of school, hi, are you afraid to get a shot? There's a triple-demic and you got it, come on. Oh, it's
But do you think it's society though? We're a little bit more dumbed down nowadays. It seems like the education out there, right? 100% by
here's
purpose.
What's great. Here's what's great. Because the dumbing down, like I said, they never had to say don't do your own research. They can't believe they had to say that.
Yeah.
Because the constant propaganda was decent enough that you're like, I don't care. People can just tell you this stuff. Like, I don't care. I remember Iraq. I was like, okay, so we're gonna blow up. You couldn't tell me anything. And now it's degraded so much, and the people they have in charge of that suck at it so bad, it doesn't even work on fat idiots anymore. And it's a real crisis.
Yeah. Do you think, though, that these type of new bosses over here are going to go after the low-hanging fruit? In other words, there's a lot of people out there.
We're going to have chips in our hand.
Yeah, well, that's...
they can sit there and be nice while the chip does it.
Yeah. But I think a lot of people who buy into this just want confirmation bias. Really, they just want the information that's suited for them. So they'll say the new CDC director says, or the new NIH, NIAID, whatever it is.
In real life, when you meet people,
yeah,
because no one. The thing that's so bizarre is no one I know personally, even the dopiest, like who would go for this, like, oh, she's nice. They don't even pay attention to this. They are like get it third hand from their friend group.
That's true.
You're not even supposed to be watching this, and if you are, you're. I mean, who is this for? The kind of person that would go like, oh, this chick seems great. You must be the dumbest, like an adult that is really into Disney World.
Kurt.
You know, that kind of person.
Do you not believe in science?
Yeah, no, like Disney. It's like Disney, though. Like, I love Disney and science.
There's more, though. This guy now, right here, Jerry Farrar, okay? He's the key COVID origins propagandist. This guy over here, right, was the one who pushed that it came from bat soup in a wet market. The number one guy.
Oh, yeah.
This guy. He's now the head scientist for the WHO as it attempts even more of a power grab with the WHO treaty, the international health regulations, where they're trying to take away, supersede the Constitution, Kurt.
I think they
where
do.
The WHO can call the shots, and it's being propagated and pushed by the West. By the United States, by Great Britain, by France.
Well,
this guy.
I think the Pokemon theory was a very successful theory. That it might be a soup bat.
Yes.
Or was it raccoon dog?
No, you saw that. The rabbit raccoon dogs.
Raccoon dog.
The raccoon dog. Oh, you choose them.
Soup bat.
The WHO in December announced that Jeremy Farrar, the head of the Wellcome Trust, is slated to become its chief scientist. He's scheduled to join the WHO in the second quarter of 2023. He played a central role in both pillars of propaganda regarding the origins of COVID in early 2020. So you see, ladies and gentlemen, it's not over. It's only just begun because why? It wasn't about a pandemic. It was about moving you into these programs, whether it be track and trace, QR codes, central bank digital currencies, shutting down over 1 million businesses here in the United States because they wanted the big businesses to swallow the small businesses. You had to be essential. It had to be Amazon. It had to be Walmart, all the places that stayed open. That's what it was all about, and that's why they had their next set of goons coming right into place to replace the old goons. As they're getting all the pressure, these guys are just sliding right in, Kurt.
Come see our live shows. We're going to be in Chicago, Rosemont, Las Vegas, Salt Lake City, New York City, Pottstown, Pennsylvania, Stamford, Toronto, Toledo, Detroit, St. Louis, and more. Go to jimmydore.com for a link for those tickets.